around the world. And we are going to take a look at equity in a little bit different way. And so the way that we're going to be looking at it is how do we level the playing field? And you're going to hear from all of our speakers about that. But before we get started, there are some of you that may not know about HerCsuite, and I'm going to take just a minute, I promise, to let you know about what we do here. So HerCsuite has expanded. We started out with a group of women, and some of you are on the call today that remember our little group of founding members. And we've expanded now. We have a DEI council, which is our speakers today are from our DEI council. And we help women individually with every phase of their careers, from mid-career through retirement and boards. And I can't wait for you to find out a little bit more. So I hope that you'll tag me or visit HerCsuite and find out more about how we do it. And everything that we do has a success formula, and it starts with amazing speakers like today, the speakers that we have on this call. When we do our programs, we do facilitated breakouts where we have a conversation peer to peer and we learn about what's important to you. And then we focus on results. And that's how we do all of our programs, whether it's a speaker summit, a week-long summit, an hour, masterminds, everything involves that success formula. So with that, I'm going to get started with this exciting panel today. I am so thrilled, as I said, to be introducing you to our speakers. I have had the amazing opportunity of knowing our speakers in advance. Several of them have been on HerCsuite radio podcast. I'm going to put a shameless plug for you to listen to them. But our focus today is on 4 key pillars: health, wealth, impact, and access. And so we're going to be talking with Dr. Nicole about health and how do we level the playing field with health. And you can read about her bio. We've got it also in your registration, but she's going to share her origin story. So I'm not going to go into too much details about each of our speakers because they're each going to talk about this. We have Susan Asay, who's the founder and CEO of Apex Group Social, and you're going to hear about her story. And I want to back up and just mention that Dr. Nicole is your GPS doc. So I want to make sure I say her company name. And then followed, we're also going to have, I'm so excited about all of our speakers. We have Kendall Palmer, who's here from London, and her company is Untapped AI. And we're going to be talking about how do you get access and what does that look like? And I don't want to tip the hand too much about what she's going to be talking about. So we'll be getting into that. And last but not least, we have Raquel Daniels. And as I mentioned, she was on HerCsuite radio. So please do check it out. She's a vice president and also chief diversity, equity, inclusion officer at HCSC. So what a powerful panel of women that are going to share some really key stories and inspire you. And as we go, if you have questions, I encourage you to pop them in the chat. We are going to be looking at the chat, but first we're going to be asking some questions individually of our amazing speakers. And I'm going to start with Raquel Daniels. So Raquel, welcome. Thank you for being here today.
Thank you. I'm happy to be here on International Women's Day. Excited about this.
International Women's Day. I know I keep doing
this. Yes. And if there's any women, if there's any men on the call too, we're happy to have you too.
We are. Right? Yes, supporting us. That is so important. I am excited for people that may not know you to share your origin story about equity and how you view it, because I think that your story is so unique. So I'm going to turn it over to you and have you share.
Well, thank you. I'm once again excited to be here, and I think this is a great conversation. And, you know, my background has been in the experience of diversity, equity, and inclusion, and I come through it in many ways. I started my career as a child protective service investigator and found my way in for-profit, and then now I'm with HCSC. When I think about equity, in the conversation that I think may align with us today is equity and equality are often interchanged, right? And I think it behooves us to begin the conversation with how do we think about defining them? How do we think about the separation, right? And so I'll utilize a little example. If I gave all of us on the call today a shoe, if I brought us all shoes, that's equal. That means everybody got a shoe. But if I didn't bring you the shoe size that you need, for instance, I wear a 9 narrow. So if I brought any of you, if I bought Natalie a 9 narrow and she needs a 6, then that's not equitable. She didn't get what she needed, but she did get a shoe, and that's fair. And so when we talk about this conversation of equality versus equity, what we want to do is ensure that you not only get a shoe, everybody gets a shoe or everybody gets a lunch, but they get the shoe that they need. And when you get the shoe that you need, that allows you to be able to play and run and be on that level playing field, right? And so when I think about it for us today in this conversation, I think there's 2 points to it. I think number one is having clarity about the definition, having clarity about how we can think about it, right? And apply it in our everyday lives. But I think also as women, we can lift and amplify our voices to have that understanding about what we need and being worthy or being our own champions to speak about what we need in this whole dynamic of life. And so whether it means your everyday when you're with your family or whether it means at work, it's having the clarity that I'm my advocate. And so let me talk about what access, maybe what equality or what equal access I need, but the difference in that access that I need to help me be the best and show up in the best way possible that I can. And I think the separation of those two, equality versus equity, also allows us to separate the idea of value versus worth, right? Because sometimes we interchange all of those things. And so I'm worthy of a access, I'm worthy of the equality and the equity of the access, and it will allow me to show up in a way where I can bring value, right? And so my worthiness does not equal necessarily the value. I'm worthy anyway, right? Well, we're all worthy. But the access that I'm allowed, how I'm allowed that access, the level playing field allows me to show up and bring the value in the best way possible, right? It allows me to amplify how I can contribute and what you look to me for. So I think equity and the clarity about that, if you walk away today and remember anything, it is understanding and feeling confident and being proud of. Equity means aligning that we gain access in a fair way to what we need to be able to run, in this example of shoes, being able to run appropriately. I mean, can you imagine, Natalie, if you had a 9 narrow on and you needed a 6, you're going to lose the shoe or probably break your neck as you're running, right? So you need to get what you
Yes.
need.
Yes. One of the things that you've said before, and it kind of ties into this idea of the level playing field, but as women are trying to figure out how do they get into the playing field? How do they get that access? So they need that shoe. We're going to keep with the shoe
You need
analogy.
the shoe,
They need
right?
the shoe and they need the shoe
Right,
size.
right.
And sometimes they may feel like their voice to get that shoe or to get what they need isn't always easy to have that conversation.
Mhm,
What is a
mhm.
good way that they can start the conversation? I think about this thing. I think about these words that you said all the time. What else is true? It's one of my
Yeah,
favorite quotes from you, but I don't,
yeah,
I don't know if it applies directly here, but I feel
yeah.
like it is in a way, like as we think about that.
Well, I do think it's a really good question. And, the way that I would begin to think about it is probably through the lens of the conversation we were just having of that value versus worth. And, what a better way today than to talk about imposter syndrome. I think that if you haven't heard, imposter syndrome talks about not necessarily if you have a seat at the table, but am I worthy? Am I valuable? What if somebody finds out that I'm not as smart as they think I am, when really you are, right? And so I do think it's silencing that voice that you have in your head that maybe I shouldn't ask for the raise, or maybe I shouldn't ask for the promotion, or maybe I should, anytime you're utilizing a shouldn't, that's the wrong vernacular to have in your mind. It's flip it and say, okay, what if, or what else could be true, or how might I, or I wonder if, right? Like, think about your deepest regret. And my deepest regret is always not the fear of it, it's the action that I didn't. So everybody's afraid. Lean into it and go forward and say, okay, what if I get the job? What if I knock this presentation out of the park? What if, right? So I think the first tactic is asking ourselves, or the first strategy is saying, okay, what if? And the second idea is to quieten down that voice that we've often heard of as imposter syndrome. And then the third piece of advice I would submit to you is really separating the conversation about value versus worth. They are not the same. And being clear about what that definition means and how that is impacting how you show up. And then maybe the fourth piece I would utilize is, let's reframe all of this. I mean, all of those 3 points, maybe this should be the overarching umbrella, is let's reframe how you are entering into the conversation with yourself about whatever it is, right? Because often we're our own worst critic. I don't think anybody else can bring me down more than I can bring myself down, right? And so if I can neutralize that message that I have in my head about whatever it is, I think it's reframing. And when you reframe and become your advocate and your cheerleader and say, well, what if I did that? Then you're going to level the playing field. You're going to allow yourself to be in the game. I think we've heard this and it's so cliche-ish, but it's true. Never have I heard, I have a 14-year-old son, and then I have my husband, right? And never have I heard my son or his friends say they can't play like tennis or golf. I think golf is a great one, right? I don't think I've yet to meet a man who said, I can't play golf. They say they don't, but if you meet everybody, they say they can't, right? And I did use a generalization. So please, I'm in D&I, don't post about she used a generalization. But my point is, I think often we limit ourselves and we enter into a conversation in a way with ourselves that others don't. And you hear guys all the time, sure, I can play golf. Give me the club, let me do the thing. But you find with women sometimes, in my experience, it's about, well, have I done all of these things that are going to qualify me to be able to be confident in my golf game? And so I think you have to do the work. We're already qualified and highly competent, and just allow yourself to get into the game. And that's how we level the playing field. You have to at least show up on the field, right? You cannot play the game from the sideline. So we have to show up on the field. And when you get on the field, then you gather people around you and you play the game to the best of your ability. And I'm going to take that we're all smart and we all should be there. So this is not about your competency. It is about, let me get on the field and let me put myself in action and mentally get my head right.
So many things are coming to mind, especially I think of the quote from Eleanor Roosevelt. I'm sure you know it, but no one can make you feel bad without your permission. So it's like you go on that playing field and you feel very powerful and get ready.
You
So
give it your best shot.
you give
You
it your
give it,
best shot.
I mean, all that
Yeah.
could happen is you get knocked down and you get back up and you're like,
Yes.
whew, okay, that got me. And by the way, her book is the best book. Eleanor Roosevelt, if you have not read this last book of hers, it's the best book ever. If you're not a reader or have the time, then I highly recommend audio. It's the best book.
Oh, fantastic. And we'll try to find it and put it in the chat if we can while we're talking here. And I'm going to move on now to Kendall Palmer, who's going to talk a little bit about leveling the playing field as it relates to AI and also being able to have access. And I'm excited to start with you, Kendall, to have you share a little bit of your origin story for all of our participants today to hear from you and hear your background?
Well, first of all, thank you for having me. It's a pleasure and an honor to be at C-Suite. And I want to say happy International Women's Day to all these gorgeous women here. I don't know if there's any men, but I'm shouting out to the women. It's our day. And it's really important that, we have these discussions, debates, and feel proud of ourselves. I think what Raquel said was, it is down to us. It really, really is. But I suppose part of what I do is, as well as, so many companies, so I'm coming from a company perspective, want to fix the women. But my passion is as well is fixing the system. We didn't create the table that we're sitting at in organizations. So that thing that you said, Raquel, about imposter syndrome is the most normal thing to feel imposter syndrome when you didn't create the very table that you're sitting at. It's a very normal reaction. Anyway, my background, I am a psychologist. I'm from the UK. I'm half Indian, half Irish, from the UK. And what else can I tell you about me? Yeah, I'm a psychologist, clinical psychologist. I used to work mainly in schizophrenia in the NHS. And then I moved to, I think you call it in the States, organizational psychology, I think, yeah. And I run Untapped AI, and it's our mission to create a level playing field at work. But we particularly specialize with women, but actually the one thing that makes such a difference to women becoming senior in companies is having a sponsor. So access to a sponsor. And I really challenge you all today to think about, at work, have you got a sponsor? Someone that's giving you access to power, someone that's giving you access to their networks, because many women don't have that. And I'm going to quote Carla Harris, a wonderful Black woman that is on the board of Morgan Stanley. And she says that it doesn't really matter how great you are or how dedicated and how hardworking you are. If you don't have a sponsor, you're not going to get to the top. So that's what I'm here today to really share and talk about. And I've got 5 children and I'm on my own with them. And at one point in my life, I sort of lost everything I had. So I had to bring them up myself. And it was the women around me that raised me up. And that whole concept, which is why I set the business up of Untapped AI. It was I was kind of fueled by being raised up by so many women. And I just set this business up 8 years ago to really look at how do we raise women up in the workplace. So that's my absolute passion. And the biggest insight is that women do not get promoted by having mentoring. They get promoted by having a sponsor. And all the research backs that up, and because I run a digital coaching company using AI and human, and all of our data backs that up, that women are over mentored and under sponsored. And to explain the difference, mentoring is private, it's about giving advice, but sponsoring is public. It's what they say about you when you're not there. It's what somebody with power does with you and raises you up. So it's about mentoring is talking to you, but sponsoring is talking about you when you're not in the room. And that is what I really challenge you all to think about, is who have you got sponsoring you right now? And how can you go and get the person that you want? And how do you build a really good, trusted relationship with them so they believe in you? And I am going to ask Susan to say something, because when we met, she just gave a really lovely example of a sponsor she had. So if you don't mind, Susan, just sharing that, because it's so relevant.
Totally. Thank you so much, Kendall. I'm Susan Acey. I'm here in California. I'm German. I moved here 20 years ago as part of an expat assignment for Allianz, one of the largest insurance companies in the world. They just had bought one of the biggest fixed income manager in the world here on the West Coast in Newport Beach. They bought PIMCO, and they sent me over here as the expert to integrate the two. And so through this long-standing career, I realized that without having somebody that believes in you and that can bring your name to the table, nothing is going to happen. You need somebody that puts their name, their credibility on stake in order to elevate you. And so when I left the investment management banking world, I started a social entrepreneurship. And in the last 3 years during COVID, our social mission was to bring international healthcare providers into the equal playing field of having international experience, because there's no such program as internship programs for healthcare workers and educators. There's only for the business part where you're sending people abroad or in their studies. So in that mission to find more access to other leaders in the industries, I was looking for a mentor for myself. And I didn't at the time really was very understanding of the difference between mentorship and sponsorship. And I was looking for somebody that not just mentored me, but also elevated me as the trustworthy person. And I found the founder of the Ritz-Carlton, who is an 84-year-old wonderful man from Germany who had built hotels around the world and had become, the icon for being in service to society, to his company, to the employees, to the shareholders, to culture. And through his mentorship and then his sponsorship, when he started speaking about me and my team and our organization, that immediately gave us credibility. So I encourage you all to seek out who would you love to be connected to, and reach out to them. You will be surprised if you have something important that you're passionate about. Reach out to them. They will come back to you. And the other thing is also, you may underestimate how far you have come and how much you can sponsor somebody else. So look around you. Who can you lend a lending hand and with your name and credibility and open doors? Because what goes around comes around, right? Karma is whole. I don't want to be esoteric, but it's just the human nature that when you do good, things will come back to you.
Such a great story. And you know what is really great about that is that you were not part of his company. A lot of times what we talk about for organizations, and Kendall, I'm sure you'll chime in on this, is the work you're doing is it's at a company where where you're trying to get that sponsor, you go to the VP or, we encourage people to go several levels up. And if the person scares you, that's the person you need as your sponsor. So you want to go as high as you can get to the level that you're afraid to ask. That's probably who's the right person. But in your case, Susan, you weren't part of his company. And so I think that's beautiful. And I'm sure there's going to be people asking questions of, well, how did you do it? And what are the steps in approaching? And that has to do with your network, right? I mean, you have to be intentional. And was there something intentional that you did? And then I'll go back to Kendall and ask her about what people can do with intentionality. But how did you open the door intentionally to get on his radar? Because that's a pretty amazing sponsor.
I love that, Natalie, of going a few levels up. I think that's really good. Outside your company, inside, if you want to stay there and you want to somebody to raise you up. This is all about, as Raquel was saying, is equity. It's that you have an equal chance, and women need more because they didn't create the table. So that's what you need. And men are twice as likely to have a sponsor than women. And the other thing that is really prevalent right now is that 1 in 3 women are leaving senior roles. I mean, you only have to read the news to see in senior roles, women leaving. So it's really important that we are clear about what we need. The burnout figures for women are really high at the moment. On our platform, we measure burnout, and it's higher than the pandemic. So yeah, I like the intentionality, being clear of who you need, but then what you need from them. And I suppose that fits with what Raquel said. It's the clarity of what you need and what you want. And the other thing to tell you is when you get a sponsor, because we work with the sponsors, we work with a lot of senior men of how to sponsor. We don't, because I've never believed in just doing the individual piece. We have to do the changing the system. And sponsorship is about changing the system, that typically they're men, they're not always. And that more of us, I love that idea, Susan, that more of us should be sponsoring other women. But it's really helping men and women sponsor better. You know, how do you do it? There's certain skills to sponsor. They're more about listening, not talking. They're more about listening to understand rather than listening to respond. And these skills are really important that you drive. It's an equal relationship where the sponsor will benefit from you. And so making that an equal relationship and being clear what you need and being, you know, challenging is important. So it's not just the person, it's the relationship you build with them, and how you build that is key. So we work really strongly with the sponsors to help them skill build, so that, because they often don't know how to do it.
It's really telling too. I mean, just like mentors don't always know what to do at first, it's the same thing. So helping them do that. And we're going to segue into Susan to tell a little bit about her background, where she originated, and then get to the wealth piece, but it's not what everyone's going to expect. She's got a very interesting perspective on that. So let's start with your origin story, Susan, first.
Super. Well, thank you so much for inviting me, Natalie. I was really honored, that I could be here today. I am born in East Germany, on a very little village close to the Czech border and behind the Iron Curtain. So back in the days, there was no internet. There was, I didn't even have a landline growing up. And the money wasn't really not meaningful, because you couldn't buy anything with the money that you earned when you had a job, because you had all the basics available, like bread, butter, milk, coffee, but not of any special goods. So you had to stand in line for everything, only when there's something available. So I had to learn very early on, if you wanted to have something special that is not just basic needs, you had to be creative on find the people that may have access to it and figure out what they need, what they want, and figure out what you can help them with, and have this collaboration amongst multiple people, so that the people who had something to offer would get in touch with the people that needed what they had to offer, but then in return got something what they needed. So it was a very interesting upbringing. I was very happy. I mean, it was very safe at the time. And when I was 18, the wall came down, and I realized, oh my God, there's so much more now there. And I saw Wall Street with Michael Douglas. Many of you know the movie, and I saw the trading rooms in New York, and I'm like, oh my God, I wanted to go there. At the time, I was completing my bricklaying degree, because that was the only way for me to get high school and a profession. So I was a bricklayer for 3 years, graduated, then the wall came down, and I saw Wall Street, and I saw that you can take your financial knowledge to the good or to the evil, right? Michael Douglas was the one that was squeezing everybody and trying to make money for himself. And then there was the junior person, the apprentice, who was seeing the same thing and used his financial skill set that he learned as the apprentice from Michael Douglas, or Gordon Gekko at the time, to use that skill set to good, right? So once you understand the system, you can choose if you want to be the bringing of good, or if you want to be the one bringing of evil. And so at the time when I saw this movie, I'm like, I knew I needed to get into a financial education. And 10 years later, I ended up working for a Wall Street company, happened to be on the West Coast of the US, but I made my goal working for a New York Wall Street company. And there I realized that, wow, there's not that many women in finance that are on the very high up. And I was like, why is that? And I questioned the status quo. And at the time I realized, because we're putting all of our efforts into all of our time into our careers, and trying to advance, and then the man look at you and like, oh, at some point she's going to have children, and then she's not going to want to work that hard, and she's not going to be as available anymore. And so there was a perception that women, while they were capable, while they were single, but once they had families, they have multiple diversions on their attention. And I was really put off by that. And so me creating my own solution for childcare was the solution for me at the time, because I didn't have family here. My mom, all my family was back in Germany. My husband also worked at the firm. And so he was working crazy hours. I was working crazy hours. We didn't have family here. So I created my own childcare solution that looked like family, that later on became my social entrepreneurship, to stay in the game. And then also I realized I was the most senior woman within this top firm that didn't have family taking care of the kids. And all the next generation women came to me, was like, Susan, how did you do that? How did you organize your childcare that you can still function in your job? Your husband, you still seem to be happy. You're still going weekend skiing, and you're going on your business trip, and you're taking your kids with you. How do you do that? And then I shared with them, and they're like, oh my God. So they started hiring from my short list that I created for myself. And that ultimately, when my kids were like 2 and 4, I realized, oh my God, there's now not just in diapers anymore. Now they need real quality time with mom. How am I going to do this? So I asked my firm, how can we do maybe a 40-hour part-time job? Maybe one day working from home. That was like 16 years ago. And they said, well, maybe. And then 2 weeks later, Lehman Brothers went belly up and they didn't have to do it anymore. So I quit. I quit my corporate job. And then I took what I built for myself and brought it to other professional women so they could have college educated live-in care providers with early childhood education, nursing, teaching, therapy for their families, and they could continue to function in their jobs and careers and have a little bit of higher chance of having it all. What it comes down to me for creating wealth is having access to education and understanding what the possibilities are. And the wealth equity to me really refers to this idea that all individuals and groups in a society that we live in should have equal access to wealth and resources, regardless of their background and circumstances. And if you have a more demanding family life because you have young children or aging parents, and most of the time it's the job of the women to organize that. It's just an emotional commitment that we all have to that our families come first, no matter how important the job is. Our families need to be cared for. And in most society, there are significant disparities in wealth and income, and with some individuals and groups having significant more resources than others, and wealth equity really seeks to address these imbalances. And I'm strongly advocating for policies and practices that promote this economic justice and fairness, because everybody should have access to that. And I really believe that ultimately wealth equity is about creating a society where everyone has the opportunity to achieve their full potential and live a fulfilling life, regardless of their background or circumstances, if they have family around or not. And every one of us can start with our own mindset. We can decide for ourselves if we want to be the change and allow our employees, our team members to work from home, to work remote, to have flexible work schedules, to make it so it works for them, and give them access to our knowledge and share how we overcome these life challenges. Sharing education through online possibilities, experiential learnings. And that's what we've tried to, that's what we're creating with our program. So the Apex Social Program is really an international program for educators, therapists, nurses, because that are the people that glue society together and help them through online education to understand how the financial markets work, how basic finances work, So it's really in giving them access so they don't have to get a Harvard degree in order to balance their checkbooks and invest smart and start saving early. But having that senior person that is not just mentoring them, but also say, hey, if you do a good job here, I will talk about this on my LinkedIn. I will honor you for the things. I will award you. I not award you, but I will recognize you for the good things that you're doing for others, for society, and for the smart things that you figured out. My mentees, the people that I mentor and then sponsor, I ask them, if I spend my time with you, I only spent my time with you if you promise me that you will find another person or two to pay it forward. And only those people is the ones that I personally mentor. So I want to give it back to Natalie, not to use all of your time. I could talk all day long. But
Well, it's always hard when we have an amazing panel to keep things moving along, but I am going to keep things moving along. And I'm sorry, my video seems a little slow here for a second, but our last speaker today, and then we're going to turn it over to questions. So be thinking about questions for our panel, but I'm going to turn it over to Dr. Nicole because we just, connect on the health equity piece. It's my heart. So I all of what you're saying is also important, but I can't wait for our participants to hear your story and hear about your background.
Thank you, Natalie. As the others stated, first, I just want to thank you and HerCsuite for the opportunity. It's a little daunting to follow my 3 co-panelists because they are all amazing in their own right. And I've really just enjoyed hearing the stories and seeing how it all ties in to what I'm going to share. And happy International Women's Day to everyone. In terms of my origin story, so I am a pediatrician by training. I have wanted to be a pediatrician since I was like 8 years old and would proudly tell anybody who listened when I was a little girl that I was going to be a pediatrician when I grew up. And through a lot of hard work and prayer and lots of support, was able to accomplish that goal and practiced initially as a primary care pediatrician and then transitioned to the hospital setting in the early 2000s and really had my dream job in the 2010, 11, 12, was the medical director for our pediatric hospitalist group. I had the pleasure of teaching medical students and pediatric residents, and I was taking care of patients. So I was really kind of doing all 3 things that lit me up. And right as I was kind of ascending that medical corporate career, my dad, who is now deceased, really started to have a lot of complications from his chronic health conditions. So he had diabetes and heart disease and kidney disease and lots of other things. And so his health declined in a way that my 2 older sisters and I had to very abruptly jump in and begin caring for him. To your point, Susan, about it's usually the women that take over those caregiving responsibilities. There's never a convenient time to become a caregiver, but at the time my kids were younger and both of my sisters had kids and we were, juggling marriage and parenting and careers and all those things. And so after some fumbling of how we could best serve my dad, we started to fall into our roles based on our strengths. And so me being the doctor in the family, it kind of made the most sense for me to take over managing my dad's medical care. And that mostly involved accompanying him to his lots and lots of doctor's appointments. He was in and out of the hospital, emergency rooms, nursing homes, like the whole thing. And what I discovered very early on when I started caring for my dad is that the healthcare system that I was part of as a doctor, specifically as a pediatrician, where, people generally, we go to bat for our kids. And so everybody in my world of pediatrics was very much focused on the patient as well as the family. There's a lot of listening. There's just a wealth of communication out of necessity. And when I went into my dad's world, I found that he was often ignored. I was often ignored as his caregiver. I found that his medical team was somewhat dysfunctional. They were not talking to each other. They were barely talking to him. And initially, I just showed up as Nicole, his daughter, and I would try to contribute and try to correct some of the things that my dad was saying that were incorrect, try to fill in some of the gaps. And I was largely dismissed until one day, out of frustration, I shared that I was a physician. And suddenly everybody, I was important because I had this extra title. And I saw almost like immediately how the way that I was treated, but more importantly, the care that my dad received improved as a result of my profession. And I thought that was, great for my dad, but it pissed me off, pardon my language, but it really pissed me off because every time I would negotiate some tragedy or some situation within the healthcare system for my dad, I would think about all of the other patients and families who don't have a doctor or a nurse in their family. There were so many times when I would ask questions that I only knew to ask because I was a physician, or I had the confidence to escalate matters. And not only did I have the confidence, but I knew exactly the chain of command in hospitals. So I knew how to get what my dad needed. And I was just overwhelmed with the complexity of the healthcare system in our country. And I'm in the US, we live in Maryland. And so after he passed away in 2013, I continued at my dream job, but I just had this nagging, pulling, spiritual calling, whatever you want to call it, that I was supposed to be doing something else. And you can imagine, it takes a long time to become a physician. So I fought those feelings for several years because of all of that I had invested, and also, just my identity as a doctor. But ultimately, I left clinical medicine and started my company, Your GPS Doc. And really, we exist. I mean, it's so pertinent to this conversation because we level the playing field for patients and families struggling to navigate the healthcare system. And my mission is really to show up for others the way that I did for my dad, and to provide education and empowerment and information and advocacy in a way that allows individuals to really receive equitable healthcare at a time when that is extremely difficult. Specifically as it relates to today and women, women historically and now have lots of challenges as it relates to healthcare. Those of you watching, if we were to take a poll, probably most of you would raise your hand if I asked you if you have ever been in a doctor's office or any other healthcare setting where you felt like your concerns were dismissed. And unfortunately, this is a common practice in the healthcare system where women, we are often ignored. Our physical concerns are often attributed incorrectly to mental health issues. Many times our concerns are dismissed or they're kind of minimized. And so it's just so important that as women, we learn how to own our power as it relates to our health, and that we recognize that it's not a level playing field, and that there are things that we need to do and ways that we need to show up so that we can ensure that we receive proper medical care and also the people for whom we care. So I'll stop there, Natalie. Oh,
I could go on all day asking you questions, but I'm going to ask you one, and I think you can wind in the story that I'm going to ask you because it's so powerful a story as we talk about women and health equity. And you hit it on the head, because I would say out of everyone here, I'm sure everyone is going to raise their hand and say, I have a story. I have yet to meet a woman who doesn't have a story of some sort, whether it's her or someone that she cared for. But as we think about how women can advocate for themselves, you have a system that helps women, navigate the system. And before we do that, because I really think the story is so important, there's someone very famous that was neglected and almost died. And it just shows the inequity in healthcare. So I'll let you both talk about Serena Williams in that circumstance, and then also how women can advocate for themselves, and then we'll open it up to questions.
Sure. Yeah, you all probably saw the headlines a few years ago about Serena Williams and the fact that she, after having her daughter via C-section, she had a life-threatening complication. And it just so happens that Serena Williams had that same life-threatening complication 5 or 6 years prior. So she knew exactly what was happening. She knew what the symptoms were. She remembered, okay, this is exactly how I felt when I had these symptoms before. And so I think a day after she delivered her baby, she started having shortness of breath, difficulty breathing, went to the nurse and said, I think I have a pulmonary embolism, which is a blood clot in your lungs. And not only did she tell them what she had, but she told them exactly what tests that they should order, because again, she had been through this before. And in typical fashion, she was ignored and told, oh, you just get some rest, and all these things that we often are told. And it was really with her persistence that ultimately they did obtain the medical test. Of note, they did another test prior to the right test. That test was normal. And then they did the test that Serena, a non-physician, requested, found that she indeed did have a blood clot in her lungs, and then started the therapy that saved her life. And this story is important because not only is Serena Williams a woman, but she's a Black woman. And it really speaks to the idea of intersectionality, and that, as women, we face all types of biases and injustices and discrimination. But when you're a woman and a person of color, or a woman in any other marginalized identity, whether it's lower socioeconomic status, or, a member of the LGBTQ community, or any other disability, if you add anything else on top of being a woman, you have even a greater chance of facing disparities in the healthcare system. And also that just points to the fact that it doesn't matter how much money you have, how much power, influence, at the end of the day, she was a Black woman in America in a healthcare system that is fraught with all types of biases and structural racism. With regard to my system or my framework, so it's called the GPS system, and I recommend this to my clients. I recommend this to patients, family members, really anyone who will listen. And it really is just a framework for how you can show up, or really how you should show up in the healthcare system in a way that allows you and your family members to get the care that they need and deserve. So the G is to gather information. And that really speaks to the importance of asking questions. So often, and this is true of women, really everyone, but we often defer to, the senior person in the room. And so a lot of times when we go to medical appointments, we kind of know already, like Serena, we know what's wrong, or we think we may know what's wrong. But if the doctor or the nurse or someone else in the room starts to dismiss that, then we kind of shrink and we think, oh, well, they know more than I do. So asking questions is extremely important. It allows you to find out more about what's going on with you. It allows you to engage in dialogue and conversation with the experts. And it also just allows you to walk away with a really clear understanding of what's going on, what needs to happen, what are the next steps. And so asking questions is incredibly important. And sometimes your questions will shift the trajectory of the appointment, and have the doctor or the other healthcare provider think about something that they had not previously considered. And I can say that this has happened to me. So I love when my patients and families ask questions. The P is to position yourself as an expert. So I mentioned that hierarchy and people deferring to the doctor or the nurse, but you are the expert for your body. No one knows your body like you do. If you are a caregiver, you are the expert for that family member. My sisters and I knew long before the medical test showed it that something was wrong with my dad. We knew what his normal routine was, and so we could spot those very early, subtle signs. And so just owning your power and your authority in a respectful way. I'm not advocating for, going into the doctor's office, being rude and disrespectful, but owning your power and positioning yourself as the expert for your body and for the people that you care for. And then the S is speaking up for yourself, speaking up for your loved ones. And that really is about advocating for yourself, not shrinking in healthcare settings, speaking up if you feel that something's wrong, being persistent, escalating your concerns when necessary. So again, G, gather information, which is asking questions. P, position yourself as an expert. And S, speak up or advocate for yourself.
So much good information from this amazing panel. And we have just under 10 minutes left. And I want to just ask if anyone has a question, please pop it in the chat. I'm reading your messages, and I I hope that you will ask some questions. You can also, before we do that, there is something I want to ask from you, and this will require you to go off camera, on camera. But we want to get a picture of everyone doing the embrace pose, because this is Embrace Equity Day. So turn your cameras on for 5 seconds and join us. And Megan's going to snap some pics of us. Please join us. And we want to celebrate by embracing equity together. So let's all embrace. And it also feels kind of nice, right? So Megan's taking the picture, and thank you all for embracing yourselves. It's nice to, it's like giving yourself a little pat on the back. It's good. You can also stay on camera if you want. So thank you for doing that. I know that we only have a few minutes left, and I want to make sure if there is anyone, you can put it in the chat if you have a question, or you can raise your hand if you have a question, and I'm happy to call on you. We have about enough time to ask each speaker one question. And so I'm going to just dive in and ask Raquel a question as we're waiting, because I think we're waiting on some questions here. But Raquel, we recently talked about, and this isn't really about the leveling the playing field, but it is kind of, we recently talked about kindness as it relates to equity and being, making everybody feel like they're part of, a community or part of a culture. Can you touch a little bit on that? Because I think it's so important as we think about how, just like what we just did for ourselves, where we embraced ourselves, what can people do when we think about kindness?
Yeah, when you think about kindness, it's interesting from my perspective. I've had several conversations or people mention it to me lately. And I think one of the biggest ones is just saying hello and leaning in to include someone. And by include, I think it doesn't have to be complicated. Just acknowledging, as Dr. Nicole said, just acknowledging someone in the room, asking a question, giving someone space, and how do you show up, I think lends itself to being kind, right? And I think more than anything too, being kind to ourselves is probably the number one gift. Like we hear it on the airline, put your own oxygen mask on. But if I really lean into it, and I'll be brutally vulnerable to you, I've even had to tell myself this week, be kind to yourself. Like, what would I tell someone else? Like, stop being that inner critic and just say it's okay. Like, give yourself some compliments. As you said, put on some red lipstick, put on the funky glasses, give yourself a high five, whatever it looks like, but be kind to yourself. Say positive words to yourself. Give yourself grace.
Such good words to think about. And as we close it out, I want to really, thank everyone for being here today. I knew that Raquel was, she's going to be leaving in a couple minutes. So I want to first say thank you, Raquel. I want to make sure I ask you one question. So glad that you and Susan and Kendall and Dr. Nicole were here today. It's been such an honor to have all of you here. And for our last questions, does anyone have, a question specifically for our speakers, because we have about 3 minutes left for our speakers. So pop it in the chat or raise your hand. And I would love to, open it up for people to be able to ask a question. So anyone have a question, you can either raise your hand or, I'm trying to watch the chat and see what's coming up in here. We've got some wonderful comments, about how important it is in the Black population, both men and women, receiving less than empathetic care. So thank you for that comment. But does anyone have, I'm sorry. Okay. Milverine, please share.
Yes, hi. Happy
Hello.
International Women's Day to all. And the presentations the panel was excellent and provided a lot of information. I'm trained as an internist, so Dr. Rochester, I do understand the difference between pediatric, where everything is much better than once you get to the adult world, and particularly for the elderly Black population who currently have the worst health outcomes in all disease categories. And so how people interact, physicians or staff interact with patients is a big part of the negative health outcomes. And just one of the things I just want to point out, I do a lot of patient engagement and cultural competence training. And what I realize is that cultural competence is not, the Black population is not included in the cultural competence conversation, particularly the elderly Blacks, and so cultural competence to me to improve health outcomes have to go from American-born physicians to foreign-born patients, but also foreign-born physicians to American-born patients, and American-born physician to American-born patients who are different than themselves. I'm just humbled by the stories from the elderly Black population that nobody considers. Patients said, my parents were a step away from slavery and my grandparents were slaves. Was I expecting that on Monday morning, 9 o'clock? but I will just leave it there. But thank you so much in the recognition of the topic and the caring. And okay, I'll shut up now.
No, we're glad to have you. Glad to have your question. We have time maybe for one last thing. So Kendall, do you want to, you have to go?
Yeah, I have to go.
Okay.
That was
All right.
wonderful.
Thank you, Kendall, so much for being here.
Wonderful.
Thank you. It's been such a pleasure to have everyone here. And it's been wonderful to see some familiar faces, some new faces, some names I recognize, some names I don't know. So if I don't know you, please send me a message. I would love to know more about you. And if anyone has a last question about what we're talking about, please raise your hand. Dr. Sylvia.
Yes, I just wanted to say thank you so much for hosting this today. What a phenomenal way to spend International Women's Day. And to all the panelists, I feel like this is so important because when we've been in this space for a while, you can take for granted and think like, oh, I know everything. No one knows everything, right? I learned so much today, just and even new perspectives. So thank you, Dr. Rochester, for posting this and for getting us in spreading this information. And I think it's always important that we all continue learning and growing because this is how we evolve and help raise up those other women and sponsor more women. So that's what I wanted to say. I have tons of questions, but I will just, how do we stay connected in this wonderful community? That might be the best way to ask because this is an ongoing conversation.
Well, thank you for asking that. That's a perfect segue to, as we're going to wrap things up. So I'm very proud to say that all of 4 of our panelists are part of our DEI Cross-Organization Council. And this is the type of thing that we do inside our C-suite. We have outside speakers come in, and then we have facilitated conversations and breakouts. And some of you are members and some of you are not, but this is the way that it happens. So I think we can pop up, Megan, if you want to pop up the QR code, you can just snap it with your phone or find, we'll be sending out a post-event communication, but we really believe in the community and the power of all voices. And it's been such an honor to be with you here today on International Women's Day and to be inspired by the stories of our speakers. And I can't wait to continue having them. And please do check out the first 2 podcasts, but I think I'm going to be talking to a few other, the other 2 guests today that are going to also be on HerCsuite Radio. So please check that out as well. And we look forward to staying connected with you. So thank you all for being here today. Embrace yourself today. Be kind to yourself. Give yourself some, some great pat on the back for how wonderful and amazing you are, and keep shining your light out. The world needs you. Thank you for being here today.